Can I avoid L4, L5 disc bulge surgery? Can I avoid L5S1 disc bulge surgery? Great question. One of the most commonly asked questions I get in the comments below my videos. And in this video, I'm going to answer the question, can I avoid disc bulge surgery in my lower back for L4, L5 or L5S1 disc bulge? Hey there, it's Dr. Walter Salubro. I'm a chiropractor in Vaughan, Ontario, Canada. Welcome again. We help people with chronic spinal conditions to get rid of their pain related to those chronic spinal conditions and improve their spinal alignment without surgery using corrective chiropractic methods. And we provide a structural care program that has helped many people with conditions like back pain, neck pain, pain associated with disc bulges, and symptoms like arm pain, numbness, and tingling. In this video, not only am I going to answer, can I avoid L4, L5 disc bulge surgery, or can I avoid L5S1 disc bulge surgery? I want to show you with my model a little bit more what entails with a disc bulge, why it's so painful, why it causes disability, as well the two main reasons that could require surgery and may require surgery, and some of the things you can do to avoid surgery in the lower lumbar spine for L4, L5 disc bulge, L5S1 disc bulge. So if you're new to this channel and you like the content that you see in this video, please subscribe by clicking on the red button below, tap on the notification bell so you don't miss out on great new fresh videos I put out on a weekly basis. Also turn on the notifications on your handheld devices like your phones and your tablets so you don't miss out on those notifications. Let's get right into this. So why is a disc bulge so painful? Why is a disc bulge in the lower back causes such suffering, disability, and low quality of life and lots of problems? Check this out. So here's a spinal model right here. So that's an example of a disc bulge right there, okay? So let me put that close right there. You see that? That's a disc bulge. Here's an example of a top view or an aerial view of the actual disc as well. Those gaps in the disc right there, those are called annular tears. The outer fibers right there, the outer fibers, those are the annular fibers of the disc. Very tough cartilaginous fibers. The inner pulpy thing there, that red thing in the middle, that's a nucleus pulposus. When the annular fibers tear, then the nucleus pulposus begins to bulge out into the outer annular fibers and begins to form a bulge. When that bulge becomes bigger and bigger, it becomes a protrusion or herniation. So two things you need to know about this. Number one, a disc is highly sensitive to tissue injury, creates a ton of inflammation, inflammatory byproducts. That triggers a massive pain response. So a disc injury, a disc bulge, that in and of itself is a pain generator, can cause local back pain, can cause sharp local back pain, achy pain, diffuse pain because of the inflammation, the chemical irritants that are in the area. When that disc bulges out, right there, when it bulges out and it irritates the nerves go into the legs, the thighs, the legs, they go into the foot, can cause leg pain, thigh pain, calf pain, heel pain, foot pain, numbness and tingling. Excruciating pain when those nerves are involved, not just while walking and standing, but also while sleeping. Now, the other thing you need to know about the lower lumbar nerves and sacral nerves is they also control organ systems like the bladder and the colon. So there's really two main reasons that someone may require surgery when it comes to an L4, L5 disc bulge and L5S1 disc bulge. One is extremely rare, and it's called Cauda-Equina syndrome. And that's when there's this massive, serious disc bulge inside the canal of the lower lumbar spine, compressing the Cauda-Equina nerves and now affecting the function of the bowels and the bladder, which means within 24 hours, you want to go to the bathroom, but you can't. There's a neurologic compromise that requires immediate emergency surgery. Haven't seen that in my office. It's very rare to encounter. It's not impossible, but rare. But you need to be aware of it as a red flag. Also, if there's saddle anesthesia, it's that numbness in the saddle area of the buttocks and inner thighs. In order for those nerves to be irritated, you need a massive lesion, a disc lesion that compresses nerves deep inside the spinal canal in the lower lumbar area, which is not very common. So you need a very serious disc blowout or disc herniation. So that's one of the main reasons that requires immediate surgery. So that's pretty obvious when that happens, and no matter where you go, no matter which doctor you see, they catch those red flags, they'll send you to hospital for surgery immediately, and typically you'll be under the knife within hours because of how serious it is, and rightly so, because it's fully warranted and necessary because of the neurologic compromise. The other reason I've seen with surgery when it comes to lumbar discs and low back discs, like at L4, L5 or L5S1, is when there's just massive amounts of pain, and the quality of life has just been debilitated, and there's nothing that gets rid of that pain, no matter what, whether it's conservative care or whether it's medications. I'll give you an example. I had this man that literally, he called me on the phone and he got to my office and he was literally crawling down the hallway right there. There's my hallway right there, down the hallway on his hands and knees to get to my exam table. And there's very little things I can do with him to check him because he was in such excruciating pain, such disability, on his hands and knees, could not move whatsoever. He had a very massive, serious disc bulge, and there's nothing we can do with him conservatively with chiropractic care in that instant, that moment. He went to the emergency room, went to the hospital. I called him on Monday. He was in the hospital room, and he said, I just went under surgery this past weekend. So unfortunately, there are cases like that, but those are extreme cases. Now, on the flip side, I'll give you another story, because it is possible to avoid disc bulge surgery, especially when the disc bulge injury is caught early enough and it's treated early. So there's a gentleman that came into my office and he woke up one morning and he was totally fine. He has a history of back pain, but totally fine that morning. And in the afternoon, he came back into my office and he said he had an immediate onset of low back pain and leg pain that went down to his foot. Right down to his foot, and it was like a shooting pain to his leg and numbing tingling to his toes. And we did some checks on him, and one of the differential diagnoses was a disc bulge at L4-L5, and it was later confirmed by MRI. But in the meantime, he was under care. We were adjusting him chiropractically. We were doing corrective methods. We were working on his posture. And over the course of 2 to 3 months, his pain and his abilities improved. So his pain decreased and he was able to walk better and function better and get back to his normal life. He still has some residual numbness and tingling to his toes, but eventually 90% of it resolved within the 3 to 4 months of care. The difference between those two cases is that the first person, even though he came into my office crawling on his hands and knees with tons of pain in his back and leg, nothing I can do about it conservatively, that was a process that was building up for him for months and months and even years. He let it go for too long. Do not let a low back condition, especially disc bulge condition, go too long. The moment there's initial onset of some kind of pain or leg symptoms, you need to get checked immediately, whether it's your doctor, whether it's your chiropractor or a therapist, and you need to do some kind of conservative care. And I'll give you some things that we do in our office for this. And when you catch it early enough and you handle it with conservative care early enough, then at that point, there's a high probability that the disc bulge surgery will not be required. In fact, many doctors will say that in most cases, a disc bulge condition, surgery can be avoided. And the case is when you catch it early enough. So it's very, very important to get that diagnosed and get that cared for early enough. Now, some of the things that we do in our office is we provide corrective chiropractic care. One of the techniques we use is called chiropractic biophysics. And we correct the spine with chiropractic adjustments. We work on posture to improve the balance of the posture. We also work on improving the spinal alignment when there's distortions and abnormalities in the sagittal plane of the spine or the coronal plane of the spine. We catch that on x-rays. That over time leads to disc injuries and disc irritations and disc lesions and eventually disc bulges. And at some point, the irritation will catch up and cause an active disc complaint. So we apply corrective techniques to help stretch the spine into proper alignment, improve the abnormal conditions of the spine, improve the postural conditions, improve the mechanics and mobility of the spine, give people core exercises, a whole bunch of things we do to rehab the spine. And that's how we get people better with corrective chiropractic care. So if you have a disc bulge injury, I want to hear about it. Comment below. Let me know what it's done for you in your life. Let me know the kind of things that you've done and what's worked for you. As well, I also have another video that I want you to watch. It's a video that has 4 exercises for L4-L5 disc bulge or even L5-S1 disc bulge. It's a very popular video, has over 2 million views. Be sure you watch it right over here to catch more exercises and continue your learning about the kind of things that can help with L4-L5 disc bulge to avoid surgery. As well, remember to subscribe to this channel and comment below to leave a message if you have any questions.